Hello, it is now 2 p.m. Eastern Time. You have joined the webinar on using local innovation to address racial disparities in behavioral health and criminal justice programs. To allow for additional sign-ins past the hour, hello, thank you for joining today's webinar on using local innovation to address racial disparities in behavioral health and criminal justice programs. My name is Felicia Lopez-Wright, and I'm a senior policy analyst at the Council of State Governments Justice Center. I will be facilitating part of today's webinar, which is hosted in partnership with the U.S. Department of Justice, Bureau of Justice Assistance, or BJA, and the National League of Cities, NLC. Next slide, please. To give you an overview of today's webinar, first, we will do introductions of our speakers and provide a brief overview of BJA, the Council of State Governments Justice Center, the Justice and Mental Health Collaboration Program, and the National League of Cities Justice Initiatives Institute for Youth, Education, and Families. Then we will get into the content of this webinar, which starts with a review of strategies to decrease racial disparities and implement programs with equity. And then we will hear local examples of prioritizing race equity in the development of criminal justice and behavioral health programs. And we will have also a facilitated discussion with local leaders from those examples. At the end, we'll have time for questions and answers. Just to stay on this slide for a second, I do want to just recap some housekeeping items. Anytime during the webinar, you can ask a question by clicking on the Q&A button at the bottom of the screen and entering your question. This includes both technical and content-related questions, and we will try to reply to the technical questions in the chat as we go along with the presentation, and we will hold the content-related questions for the end. If you encounter any technical or audio problems during the webinar, we chatted out how to troubleshoot that, but please understand that there are some technical issues that we may not be able to resolve during the webinar. But we are recording the webinar and it will be posted on our website within 1 to 2 weeks. Next slide, please. So as you know, my name is Felicia Lopez-Wright, and I'm a senior policy analyst within the Behavioral Health Division at CSG Justice Center. And I'm joined by my colleague, Jasmine Wilkerson, who is a program manager in the, a project manager in the Behavioral Health Division. You'll also hear from our partners from NLC, Kirby Garrity, program manager for Justice Initiatives, and Tony McWright, senior specialist for Justice Initiatives. Next slide, please. We're also excited to introduce you to the local leaders that will share about their firsthand experiences with building race equity within local initiatives at this intersection of criminal justice and behavioral health. So from Charlotte, North Carolina, we have Julia Martin, assistant to the city manager, and Federico Rios, assistant director for Housing and Neighborhood Services Department. And from the city of Minneapolis, Minnesota, we have Taylor Crouch Dodson, program manager at the Office of Performance and Innovation. And last but certainly not least, we have City of St. Louis, Missouri, Wilford Pinckney, Director of the Mayor's Office of Children, Youth, and Families. So thank you all for joining today's webinar. Next slide. So the Council of State Governments Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. This slide describes a bit more about our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Next slide. The overall goals that guide our work at the CSG Justice Center are to break the cycle of incarceration, advance health, opportunity, and equity, and to use data to improve safety and justice. Next. The Council of State Governments Justice Center is committed to advancing racial equity internally and through our work with states, local communities, and tribal nations. We support efforts to dismantle racial inequities within the criminal and juvenile justice systems by providing rigorous and high-quality research and analysis to decision makers and helping stakeholders navigate the critical and at times uncomfortable issues the data reveal. Beyond empirical data, we rely on stakeholder engagement and other measures to advance equity, promote guidance and technical assistance, provide guidance and technical assistance, and improve outcomes across all touch points in the justice, behavioral health, crisis response, and reentry systems. Next, please. The mission of the U.S. Department of Justice Bureau of Justice Assistance, or BJA, is to provide leadership and services in grant administration and criminal justice policy development to support local, state, and tribal justice strategies to achieve safer communities. BJA works with communities, governments, and nonprofit organizations to reduce crime, recidivism, and unnecessary confinement, and promote a safe and fair criminal justice system. Through the Justice and Mental Health Collaboration Program, or JMHCP, BJA aims to help states, local government, and tribal organizations improve responses to and outcomes for people with mental health conditions or co-occurring mental health conditions and substance use disorders who come into contact with the criminal justice system, and support public safety by facilitating collaboration among the criminal justice, juvenile justice, and mental health and substance use disorder treatment systems. So I'm now going to pass it over to Kirby to continue with introductions. Thank you.
I actually think that Tony's going to handle this slide and then take it over to me. Go ahead, Tony.
No worries. Thank you, Felicia and Kirby. Again, Tony McCright, Senior Program Specialist here at the National League of Cities, where we advocate for all 19,000 cities, towns, and villages across the country. Just to give you a little background on what we do, Kirby and I are in the Institute for Youth, Education, and Families, which is the place to go for city leaders seeking to improve outcomes for children and families. And in our 5 departments, we reach cities of all sizes and bring together local leaders to develop strategies by way of technical assistance projects and peer learning networks, which I'll talk about briefly in a second, as well as mayors' institutes. One of those departments is the Youth and Young Adult Connections team, which houses our Justice Initiatives team, which Kirby and I represent today. And we build on the work of the Reimagining Public Safety Task Force. And this task force was convened last year and consisted of over 20 mayors and local leaders from across the country to address racial inequities right after the murder of George Floyd. This was a bipartisan-led task force led by Mayor Baraka of Newark, New Jersey, and Mayor Holt of Oklahoma City. And this task force produced recommendations for cities across the country to implement, as well as a subsequent toolkit to help implement those recommendations. I mentioned the technical assistance that we provide to local leaders. Just to give you some examples, we have a couple of projects ongoing now. One of them is in the Twin Cities area, where titled Reducing Harm Through Collaborative Solutions, where we are working with 4 cities to collaborate with the community to reduce harm through these solutions. Also, a 5-city project from the Midwest to the East Coast, municipalities reimagining community safety. Now, both of these projects center community by bringing them in the implementation, the execution, and at the very beginning, giving them a seat at the table to plan the solutions to their community's public safety issues. We also have peer learning networks. 3 of them that I'll name are 2 led by Kirby, City Justice Policy Advisors Network, which is a network for mayors, advisors to reimagine and achieve public safety through a more equitable lens. Our Young Adult Justice Community of Practice works to develop strategies to address disproportionate rates of arrest and jailing of young adults and racial and ethnic disparities. And our newest one is our Municipal Reentry Leaders Network, which brings together city-led reentry directors as well as higher ed institutions in the reentry realm to discuss best practices and promising practices that lead to successful integration to our communities of our returning citizens. Next slide, please. And so today, we would like to come away with an understanding of how racial equity is linked to the social determinants of health and diminished opportunities. And once we have that understanding defined and understand the importance of implementing a racial equity lens into these programs, and then taking that lens and understand how to use the racial equity data to implement program change. And we'll definitely hear from local leaders how to apply a racial equity lens in services and diversion opportunities, and finally obtain strategies to address racial disparities through local equitable innovation. And I will now turn it over to my colleague, Kirby Garrity.
Thanks, Tony. As was mentioned, I'm Kirby Garrity. I'm the program manager for justice initiatives here at National League of Cities. And I'm just going to talk a little bit about how we're defining racial equity and touching on a little bit of the social determinants of health. You can go to the next slide. As we know, racial equity can be defined in many ways, and those definitions can really be nuanced based on where you live or where you work. But we thought that this definition by Race Forward was a strong one and somewhat inclusive. So I'll read it. Racial equity is both an outcome and a process. As an outcome, we achieve racial equity when race no longer determines one's socioeconomic outcomes and everyone has what they need to thrive no matter where they live. As a process, we apply racial equity when people most impacted by structural racial inequity are meaningfully involved in the creation and implementation of the institutional policies and practices that impact their lives. Next slide. I also want to, before I touch on this slide, NLC has a race equity and leadership team, the REAL team. They're a really great resource for racial equity in all aspects of city government and cities. So I'll make sure that I drop their information in the chat once I get through with my slides. So equity and opportunity are tied to one another across all systems. We rarely see great levels of inclusion alongside opportunity. As we hear from cities and have discussions today, we just want to keep in mind that every community is hindered by systemic racial inequities and that inclusive prosperity remains elusive among America's metros and cities. Next slide. Also, we want to keep in mind the intersections of health, justice, and equity, and also safety. This graphic represents the social determinants of health, and the social determinants of health are really the conditions in which people are born, grow, live, work, and age. They include factors like socioeconomic status, education, neighborhood, physical environment, employment, and social support networks. And an important one is also access to healthcare. Next slide. And for BIPOC communities, the social determinants of health and their connectivity to justice and safety are all the more apparent. Higher rates of poverty, increased interactions with law enforcement, over-policing, the biases that exist within the criminal legal system, and so many other factors are what bring us here today to talk about equity. And I'm just going to read the quote at the bottom. Racial disparities in incarceration cause disproportionate economic, health, and social harms to communities of color, and that is from the Vera Institute. Next slide. And so obviously today we're here to talk about the importance of racial equity in criminal justice and behavioral health programming. how to braid equity into justice and health systems in cities. A key piece of that is the involvement of those most harmed by current systems and the acknowledgement of the divestment and distrust that exists in cities, specifically in BIPOC communities. Next slide. Data is also a really important piece of all of this. In our conversations today, we will touch on racial equity data, both qualitatively and quantitatively. This is an important part of the work. And I'll just quickly read through these bullets. We must look at the root cause of disparities in justice involvement, arrests, and sentencing to understand how we make progress. Examine the link between social determinants of health outcomes and those involved in the justice system with mental health conditions. And building a more equitable justice system starts from within the community. Next slide, please. And so systems and assessments are an important part of this work. We pull the next two slides from a report from Race Forward. Obviously, we're excited about Race Forward's work on equity assessment tools. And here we're looking at some of the points in which there are options, what they're calling choice points, to do better from an equity perspective. So some of those examples are at the point of arrest, sentencing, and post-incarceration decisions. Next slide. And you'll here you'll see, some of the questions that can kind of be considered at each of those choice points. What are the decision-making points that affect racial inequality? What decisions or actions may reinforce the status quo, which include implicit bias and current inequities? And what are some of the alternative actions that could produce equity? And so we'll hear a little bit from cities today about what they're doing in this space, but just wanted to touch on some of the points at which we could be asking these questions. Next slide, please. And so before we get to hearing from our city representatives, I just wanted to end this introductory portion of the agenda today with some considerations. Equity cannot exist without inclusion. And some of the kind of subpoints to that are to consider creating or adopting racial impact assessments, acknowledge the cumulative nature of racial disparities, encourage communication across players in all decision points of the system, know what works at one decision point may not work at others, work towards systemic change, and equitable implementation works to address cultural, systemic, and structural norms that privilege some groups over others. Next slide, please. All right, so we are going to now move into some of the local work that bridges equity, health, and justice. We have representatives from 3 cities to talk about their local work and the successes and challenges that they've had when it comes to utilizing an equity lens and implementing some of these initiatives. So next slide, please. I know they've already been introduced already, so I'll just really quickly list their name and just remind folks to add questions to the chat or to the Q&A. And after the cities have briefly presented about their work, we'll make sure that we get to some of those questions. So we're going to kick things off with Julia Martin and Federico Rios from the city of Charlotte, who will talk about components of their Safe Charlotte plan. Julia and Federico, it's up to you.
Well, good afternoon, everyone. Thank you so much, NLC, CSG, for the opportunity to present today amongst the experts. It's a great joy to do that. If we can move on to the next slide. So again, my name is Federico Rios, and I serve as the equity officer for the city of Charlotte. I man the office that's listed there above. In 2019, there was a recognition that we as a city had to commit to equity. Just giving you kind of the landscape around Charlotte. Charlotte in approximately 2015 was ranked 50th out of 50 by Raj Chetty and researchers from UC Berkeley that found that we were the worst place in the country for economic mobility. What that story really tells is, or really speaks to, is the stratification, the limits that have been put around diversity in this community, the fact that we are a highly segregated community that has limited upward mobility opportunities for individuals, specifically persons of color, specifically our African-American Native population. And so bringing that to mind, that really set the stage for the work that we endeavored to do in the creation of the office. One of the first things that came up, and important to recognize that a lot of times offices of equity don't get into the weeds around programming, but there was a recognition very early on that we really needed to tackle some of the challenges that were faced around law enforcement and how it disproportionately impacted persons of color in our community. And so, as you see in the slide, we recognized this fact and began incorporating a public health approach to our strategy. In February of 2020, our council actually approved the implementation of this approach and a framework that would provide structure for our continued work. Moving to the next slide. And so here's the framework. It really speaks to the intersectionality and their interrelatedness of the different streams that occur in space, right? So we're really trying to take into account best practices that are applied in our communities. We're trying to work collaboratively. So this intergovernmental approach that you see is actually between ourselves and our county government. I know some of you all work for cities that have that distinction and separation of work streams. And so we are really tactful in how we employ strategies related to that. We decided locally to apply the Cure Violence Global model, which is a recognized model and evidence-based approach to addressing violence in a different way. We recognize the disproportionality that was referenced earlier in regards to policing in communities of color, and we wanted to take a different approach. And so we began utilizing credible messengers that have connections in the community, that have been a part of the justice system, and could more readily address the needs of their own community because they live within it. So that goes into the interrupt violence piece and the invest in community-led efforts. As a city, we've plugged in more than $35 million into our what we call our corridors of opportunity, which goes back to what Kirby shared around communities that we have not invested in for an extended period of time. And those communities, again, are communities of color. And more than anything, we continue to use data and evidence in these bodies of work. With that, I'll shift to my colleague, Julia Martin.
Thanks, Fed. Next slide, please. Good afternoon, everyone. Julia Martin. I work in the city manager's office here at the city of Charlotte and work closely with Federico on a number of these Safe Charlotte initiatives, including some of the work that he discussed on the framework to address violence. For us, when we talk about Safe Charlotte, it really is a layering of these three initiatives that you can see the timeline on the bottom have all started at different points within the last couple of years in our city. And so we started to see a big increase in homicides. We worked with Johns Hopkins and GovX to understand a bit more about the data around that. And so out of that, one of the things in the framework was use data and evidence. So as a result of that work, we launched a publicly accessible data violence dashboard where you can go and see the demographics of individuals, perpetrators and victims involved in violent crime. And so one of the things that really drives us is using data best practice to guide our work. As Fed mentioned, again, we have the corridors of opportunity, which are 6 areas of historic underinvestment, mostly minority communities here in Charlotte. And Fed said 35 million, it's closer to 60 million on the city side, and then, upwards of 100 million when we include investments that private organizations and businesses have made going along with how we are investing. Our local United Way chapter here has actually reorganized their whole investment strategy to match what we're doing in the corridors of opportunity. And so it has really become a thing for the community to galvanize around in terms of how do we holistically support and invest in communities of color that we've, historically forgotten. And then the Reimagining Policing work, again, happened after the murder of George Floyd in the summer of 2020. And so what we did there was Fed actually led this work working with a community input group, which included a wide variety of individuals from across the spectrum in terms of their thoughts and beliefs around police. And so that included a former deputy chief, community activists, really pro-police individuals, faith-based individuals. And so working with them over a couple of months to develop 6 key recommendations that they wanted to see, and council eventually endorsed and approved the Safe Charlotte plan in October around what reimagining policing means. But the Safe Charlotte report for us, it really does include how do you holistically support a community in a way that makes it safer for everyone. So that is providing access to jobs, addressing violence, improving the housing stock and making sure individuals can have housing. And so really thinking in a complete way about what is a safe community. Next slide, please. And so here are the 6 key recommendations from the Safe Charlotte report. I won't go through all of them. I'll just point out a couple. So recommendation 3, we worked with the RAND Corporation to do what it says there, an external analysis of how police interact in our community. And so what the question we were really asking them to answer is there racial bias in how our police interact in the community? And so we sent them, I believe, 12 million pieces of data, 5 years of information. It was an incredibly extensive report. And so, you know, the results were, yes, in some instances, we do see police acting disproportionately towards certain communities over others. And so what CMPD, that's our police department, Charlotte-Mecklenburg Police Department, did with that information is they actually put in a couple of, in addition to their early intervention system, a couple of new filtering tools to be able to understand, are certain officers acting disproportionately from their peers in the community? And so it's another way for us to be proactive in terms of how we can understand how people are acting and making sure that individuals are not acting disproportionate to one group or the other. And then recommendation 4, so we have a co-responder model, which we doubled from 6 to 12 clinicians. We are working to launch in October a civilian response for low-risk mental health calls for service. So we will deploy that in our central business district and an adjacent area called the Metro Division, which is a majority African-American community. And so again, trying to provide the correct response for the correct need of our community, recognizing that not a police response is not always going to lead to the best outcome. And then the final recommendation I'll touch on is recommendation 6, which the words on the screen wouldn't necessarily tell you that, but it really is, how can we attract and recruit more officers who reflect the demographics of our community? And so we have a very majority white police department right now. And so working hard to attract, non-white individuals, females into the policing profession. And so we worked to streamline our recruitment process, enhance some of our events out in communities, especially partnering with Johnson C. Smith, who is our local HBCU, to provide awareness and opportunity for individuals to see policing careers and professions when they are coming out of college. And so I'll put in the chat where everyone can go and find more information for each of these recommendations. With the exception of recommendation 1, we have a whole report done by a consultant that you can go and read. We have a couple of different layers. It's probably about 100 pages of content if you are really curious. If you're only a little bit curious, we have a slimmed down version that's about 20 pages, but I'll put that in the chat. And so I think that is it for us. So I'll turn it over to Minneapolis.
Wonderful. Hello, everyone. Thank you for having me here today to share the work of how the city of Minneapolis is reimagining public safety. My name is Taylor Crouch-Dotson. I use he, him pronouns, and I'm a program manager in the Office of Performance and Innovation. Just to set the scene, our office kind of has like 2 main pillars of work. One is managing key performance indicators for all 22 departments and 150 divisions. And then we also act as an in-house consultancy to do process and policy improvements to city services. And we'll be kind of diving deep into that process here today. For the past 2.5 years, our team has been supporting the engagement research and pilot implementation for our team's portfolio of unarmed public safety pilots, including today's highlight, which is the behavioral crisis response team. Today, the BCR is a first responder program dispatched by 911 as a standalone responder to de-escalate and support people experiencing a behavioral health crisis. The goal is to give people in crisis an unarmed response that can properly assess their needs and provide appropriate care or support while avoiding unnecessary criminalization and hospitalization. Today, I'll be specifically sharing our portfolio as it relates to our human-centered design approach called inclusive design. Next slide, please. According to the Harvard Business School, human-centered design is, quote, a problem-solving technique that puts real people at the center of the development process, enabling you to create products and services that resonate and are tailored to your audience's need. In local government, our team likes to think of human-centered design as a way to center the lived experiences of those receiving services when designing improvements to that system. Specifically, our office also ensures that racial equity is at the heart of each step by prioritizing historically underrepresented communities who use the service. So I'll be kind of walking through each step and how it related to the development of the BCR. So that first step is get started, where we ensure that we're telling the proper story by clarifying the challenge, providing context, and identifying who's impacted. We actually began this work in October of 2019, prior to the murder of George Floyd and the COVID-19 pandemic, when our city council had tasked our team to look into how we might shift certain 911 calls away from a police response to an alternative unarmed option. We decided to work with city leadership to build a process map to understand how those calls were being handled and looked deeply into 911 call data to understand who was receiving those services and maybe who wasn't. We disaggregated that information by race, gender, geography, and other key demographics. The next step was discover. In that step, we started to ask questions, essentially going deeper in order to understand the problem better. In the spring of 2020, we had planned to conduct in-person engagement via small group listening sessions with key end users. But with the onset of the COVID-19 pandemic, we had to shift completely to a virtual setting. So in the summer 2020, we launched 2 surveys, one focused on non-emergency issues and the other on mental health crises. Both surveys were built with accessibility and inclusivity in mind, translated into commonly spoken languages in the city, including Hmong, Spanish, and Somali. Third step is understand. This is all about connecting the dots, and it's essentially trying to build insights from the data collected or the questions asked. So at this stage, my colleagues we had closed those surveys and we began analyzing the results. We're pleased to get over 8,000 individual responses over those 2 surveys and 23,000 open-ended responses to our qualitative questions. We synthesized the information and provided summary to our advisory group, which was a majority of community members. That data was also disaggregated by race, gender identity, and geography. Step 4 is create. It's where we go to more of an imaginative and we let go of the practical constraints of the process. And here we get to actually have some fun. So in the fall of 2020, we invited community members to join us in 4 design workshops. These sessions focused on connecting ideas back to the realities of people's experiences by ensuring they had a seat at the table. And we hosted these sessions virtually using a program called Mural Board. Step 5 is experiment. At this stage, we chose our top favorite or maybe most imaginative ideas and tested them out with end users. So at that stage, we were working with underrepresented communities to get direct feedback, and through that to understand comfort levels and ease of access. And by step 6, we're able to whittle it down to one solution. This was our most feasible and gained the highest response rate from our end users. And that was able to be characterized as one that's unarmed, plainclothed, trained mental health professionals that were local and culturally competent. That was the BCR. And we recognized at this stage that we needed to launch something new because nothing that we had either at the city or the county was offering this level of service. In December 2021, we launched the BCR and have been continuing to monitor its impact throughout its lifespan on a quarterly basis. Next slide. So this is giving you a little bit of an overview of not just our specific BCR program, which probably is the one with the most biggest seen one within the city, but it's also part of a whole portfolio. And so in November of 2020, after we had conducted our research for over a year and synthesized and designed these programs, we presented this list of recommendations to our council. They were not only adopted, but funded for 2021, and they are listed here. They range from doing more embedded work within our systems, as well as creating new programs, including the BCR, but also expanding programs like our traffic control unit and looking into a campaign to build awareness within the city. Next slide, please. So over the last 2.5 years of conducting this work, we've had both supportive moments, and we had to overcome some barriers. Regarding some supportive moments, we can highlight a few. The use of our human-centered design approach really helped to center the lived experiences, not only of our community, but of those that are underserved or historically underrepresented. We found that this shifting of the way of thinking away from a more hierarchical approach really kind of helped to change minds within the city. We're also very intentional about collecting demographic data that was expansive beyond just the traditional list to ensure that identities were being seen throughout. And this equitable approach to engagement was seen in our data analysis, workshops, and advisory group membership. Yet we did have to overcome some barriers. One being the existing culture of institutional racism at the city and overall resistance to change. The Minnesota State Department of Human Rights published a report in 2021 stating that Minneapolis police and the city at large was a perpetuator of racist practices. This was honestly not surprising to our team, who was a majority Black members, and we faced a lot of oppositions, not only from city leaders, but also within the community, where topics like public safety were highly politicized. We also pushed back against some predetermined solutions that folks wanted to start funding in order to ease the process, but we knew that it wasn't going to be an easy solution that we needed to make, especially when it came to responding to mental health crises. We were able to overcome some of those things, but it did create some tension in that process. Next slide, please. And finally, just some significant findings. One of the things that we found most interesting was our qualitative information from the lived experience of our community members, where they really identified some key needs. One was to rebuild trust with 911 because of its direct relationship to police. They had feared calling 911 because they assumed that police would be the only response option. We also needed to avoid any police interactions in general because people were fearful to protect their BIPOC neighbors. Given at the time, it was about a year after the murder of George Floyd, we were continuing to grieve as a city of what it would look like to transform our public safety system. We also needed to have excellent customer service with kind, empathetic, and patient call takers to handle issues, and a need for some sense of autonomy from the callers in order to request a certain type of response. We are happy to say that the BCR program is up and running and growing. As of April of 2022, the operation has increased to 24 hours a day, Monday through Friday with a weekend day shift. They respond to about 114 calls a week. They operate from 2 vans citywide, serving the entire city and every neighborhood. We are actively recruiting to move into a 24/7 operation, and we are expanding awareness through videos, photos, infographics shared via social media as part of our holistic Reimagining Public Safety Awareness campaign. That concludes my portion of the presentation. I want to thank you for having me today. Happy to answer questions later on in the programming. Thank you.
And now we'll hand it over to Will Pinkney from St. Louis.
Good afternoon, everyone. Thank you for having me. Sorry, I'm on the road, so if I seem a little distracted, that's what I'm in the room, not in the comfortable room necessarily. So I'm glad to talk to you today about how St. Louis is putting forth efforts to put the public back in public safety, as our mayor says. You can go to the next slide. You know, everyone here has been talking a lot about equity. Unlike, I'm sure, many of the other cities, St. Louis has a history of disinvestment, institutional racism, and most of the work that we do is really centering equity. When we think about equity in St. Louis, we think about what's called the Del Mar Divide. When you look north of that marker, which is an avenue called Del Mar Boulevard, the population is about 98% Black, with a median income of about $18,000. And south of that boulevard, the population is about 73% white, with a median income of $50,000. Nearly 70% of the homicides in St. Louis occur in low-income areas with no access to grocery stores or supermarkets for at least a half a mile. So we think about food deserts. 4 of the zip codes in St. Louis account for nearly half of the city's homicides and nearly a third of all aggravated assaults. So this sort of sets the stage for how do we think about what do we want to do in our city to change the paradigm, to think about public safety reform and how to put the public back in public safety. So when you look at this slide, really, it gives you these data points, and those data points speak to a need to decrease law enforcement contacts, as many of my colleagues have talked about. It talks a lot about traffic violations. When we think about traffic violations, and as we look into the data and talk with people in our municipal courts, most of the people who are stopped or are engaged in those types of interventions, it's really related to a lack of basic needs, root causes such as substance use, homelessness, lack of employment. And so you will see that there was a decrease in traffic stops based on a study by the Center for Police and Equity. But when you decrease those stops, you still have those challenges of traffic-related safety, pedestrian deaths, and violence. Specifically in our city, many young people steal cars, engage in shootings, or just engage in joyriding and thefts. And once again, this speaks to equity, and it speaks to needing to address basic needs. So we did a lot of work with our municipal court to really identify how we could connect people who are flowing through the court with community providers to address those needs without having an increase in warrants and increase in enforcement. So you can go to the next slide. As we look at this next slide, it points to really, to me, a question of who is responsible and a need for a data-driven approach. There's a multifaceted problem. It's multifaceted in terms of the solutions. In 2019, we really started to set the foundation of thinking about this work, thinking about equity, thinking about public safety reform by bringing together executive level decision makers, as I think my previous colleague was talking about some of the work they did in Minneapolis. And we brought those decision makers together to facilitate a conversation around how do we better collect data, how do we promote law enforcement and behavioral health integration. And the overarching goal was better aligning resources and redesigning system structures and policies. So one of the things that has led to recently is I recently became the director of the Office of Violence Prevention, which was launched in the city. That office provides strategic direction and oversight for the city of St. Louis efforts to create safe and healthy neighborhoods free of violence. When we think about reform, we need to think about multiple strategies. We do want non-law enforcement responses. We do want to address basic needs and root causes. So what does that mean? That means violence interruption. That means mental health, trauma and crisis response. That means restorative justice. That means case management, and that means data tracking. Well, those strategies are implemented by our partners in many of the initiatives that fall under the Office of Violence Prevention. We have a call diversion and a call responder program, which is like a crisis triage model. The call diversion program diverts calls at the point of a 911 call. So there's no need for any type of emergency response. So we can divert people from needless transports to emergency rooms, but also from police or EMS even have them respond. Our co-responder program, our police and clinicians riding around right now between 7 in the morning and 11 at night. They work in a different model to many others in which, like I said, they do a crisis triage model where they can respond a primary unit or a backup unit to 911 calls in real time. We are looking to launch a non-law enforcement model in the first half of 2023, but both models are really doing a lot to change the narrative, to build trust in the communities, and to better connect residents to community-based programming so that hopefully they don't call 911 at all at some point for those types of needs. Cure Violence, which is a violence interruption program, also falls under the Office of Violence Prevention. Community violence intervention, we've recently contracted with 8 community organizations for community-centered responses. St. Louis is fortunate enough to be a member of President Biden's CVI cohort. And so we have put about $15 million in ARPA funds into contracting with community-based organizations so that those people on the ground in community, trusted voices, trusted messengers who have been doing the work for a long time can help us best address the needs in those communities. We also are providing TA assistance because we know that many small organizations don't have the capacity to apply for grants. And we want to make sure we build capacity in as many organizations as possible. We also, Juvenile Diversion is also embedded in the Office of Violence Prevention. Like I said, we have many problems with juveniles or challenges with juveniles in our city. About 50 people under the age of 18 have been shot this year in the city of St. Louis. So we really need to meet the needs of our juveniles and their families. And so we're looking at bringing a national program like the Youth Advocates Program to St. Louis. And we're also looking at other cities to try and identify how we can set up some type of juvenile diversion center. And then finally, reentry services, making sure our returning citizens can return home to our communities and can be their best selves and have the opportunity to contribute and bring their skill sets to those communities as we build and make them safer is really important. And we will look at reentry not only from state institutions, but also from jail populations. So once again, there's many facets of the problems and the solution. Data is a very important part of this, and mapping. We take a data-driven approach here, as well as thinking about equity, and you need a data-driven approach to ensure equity. But we've been fortunate enough to map a lot of different types of crime data, population data, city planning data, out of school time data, and community services to identify gaps and make sure that right now, since we don't have unlimited funds, we will focus in the gaps in the collaborative work. You can go to the next slide. So as I said, I talked about this a little bit already, that we have many solutions, community-centered solutions that we're looking at and funding and supporting. I talked about the YAP program. I talked about the juvenile diversion. We also have put in money with our community partners into what we call youth safe spaces programming, which is really about events, pop-up events that are youth-led and planned, youth leadership programming. We wanted to make sure that we work through community partners to really engage youth. We find them in spaces where oftentimes there may be some of them that may engage in behavior that is delinquent in nature, but often that's because there's nothing available for youth to do. And so it was really important to make sure we have as many partners in the city as possible engaging in planning these events. So we gave $1 million just to plan youth pop-up events and provide youth leadership programming with many of our partners. We also put $1 million into what we call youth services summer programming, where we partner with our schools and youth development organizations in the summer when many youth have idle time, to provide programming from 8 in the morning to 6 in the evening in community and areas where there are gaps, to make sure that we those families and those children have someplace to go that's neighborhood and place-based, so that they could walk and eliminate barriers around transportation and cost. This is free programming, 3 meals a day, field trips, academic support. This year we branded the initiative Summer Fun STL. And so it allowed us to really focus on not so much academics, because, you know, obviously kids go to school all year, they have summer school. Sometimes they are turned off by just thinking they're gonna have to still be in school, but it was more around fun and engaging them. I think that's the last slide, right? So I'll stop there. And as my colleague said, if you have any questions, I look forward to answering.
Well, thank you, everyone. I'm going to bring all the cities back to the virtual table, and thank you all for sharing and move to the Q&A. Well, first, I'd like to congratulate Will on the new position at the Office of Violence Prevention in St. Louis. And actually, Will, I will use what you said as a segue for everyone else for a question. You said we don't have unlimited funds, right? Can you, or not just you, the panel, talk about how you fund the racial equity work that you all are doing? You mentioned very quickly ARPA, but that's temporary. That'll be used up in a couple of years. So can you all talk about how you're funding this work?
Yeah, I guess you wanted me to go first. I mean, sustainability is the top of mind, right? When you start engaging community organizations, when you start providing things that are needed and communities have been asking for a long time, you want to make sure it's not something that's going to fizzle out after a couple of years. So as I said, we've used ARPA funds, but we're also using those ARPA funds to build a grant-making infrastructure so that we can make sure that this office that I'm setting up specifically is structured in a way where we can pursue grants, federal and state grants, and philanthropic grants, so that we can make sure we can continue to work and make it sustainable in that way. We also look at how we can show our work, for lack of a better term, to make sure that we can advocate for additional general funds as time goes on, because the belief is that as we improve communities and they get healthier, that will improve the economic outcomes for the city, which will bring in more funds, which will then hopefully be diverted into this work to continue to support it. So it's a multi-pronged approach. You're going to need a braided funding model, but sustainability is definitely top of mind.
So if I can jump in there with, to add to what Will was saying, I think one of the things that we found locally when we launched to go into the weeds on one of the things that we mentioned, when we launched our local implementation of the Cure Violence Global Program, we put in $250,000 matched by our county at $250,000. And in year one, we were able to leverage a relationship with Wells Fargo Bank and the Greenlight Foundation to add $1.2 million towards that initiative. So it's this braided funding is hyper important. Getting organizations to be invested in the work and to show that investment financially is important. We were also able to leverage a congressional earmark through our Congresswoman's office and are now getting funded $1 million for the expansion of the project into 2 new sectors. And so the continued approach of looking for those opportunities. But again, that alone is not enough, right? Our cities have to continue to back this effort financially and commit to long-term work.
Yeah, it's a great question, and one that we obviously also were navigating for the BCR when we were looking to launch. We really proposed kind of like low to high fidelity options to council to say, hey, we want to run this pilot. We need to have it be over a 2-year period. And here, kind of like, how much do you want to invest into it? Do you want a small pilot or a big pilot? And when we're able to back it up with data, and also not just from like numbers, but also words and feelings and sentiments from community that wanted this, we're able to kind of really navigate the politics to go towards a larger pilot. And through that, it's that kind of constant data to show, hey, not only are we running this larger pilot, we need more. We aren't able to meet the demand. So to be able to constantly show that growth, I like how Federico put that, where if you're able to measure not only the impacts, but what you can do, but what you could do, I feel like that difference there has been something that can really help leverage more funding. For example, right now, the BCR is operating at a 2-van citywide, and right now we're in conversations to move that to 5 vans, so it's 1 per precinct. So this is something where it's that kind of constant iterative approach where we're not just done funding it, like, oh, that's now a successful program. It's like, no, this needs constant supervision and evaluation so that we can be in a sense of more continuous improvement rather than just kind of moving on to the next project.
Thank you. And I forgot to say next slide, please. I want to take a question, Kirby, let me know if we're good on time, from the Q&A, if that's all right. All right. So McCall, and hopefully I'm pronouncing your name correctly, says that each of you mentioned use of force data. Can you say more about how you acquired this vital information, and was it a challenge? And that's a great segue into continuing the topic of data that you all touched on.
I guess, you can go, Taylor.
You sure? Okay. Thanks, Julia. Yeah, so accessing data in general, I'll say, was difficult. Not only did all of our staff need to get background checks in order to access 911 or police data, we also really didn't understand the jargon. So we recognized that this is a culture that we did not know. None of us were considered, I guess, formal public safety practitioners prior to taking on this work. We more see ourselves as design thinking or policy professionals. And so getting into it definitely had a huge learning curve, but we needed, and we recognized the need to build allyship. I had mentioned earlier that we had a lot of leaders who were opposing this work. They feared changes because, you know, funding moving around, or just the kind of a general sentiment that was a very anti-police movement right now at the city. And so us coming in to ask questions felt a bit threatening. And so we really needed to build relationships, be able to ask questions, and the use of force data from both the police and 911 really helped to paint a picture of not only what they were collecting, but how. A lot of it was very subjective by the police officers, and it wasn't backed up by either census data or anything like that. It was just a lot of quick answers to just move on to the next emergency. And we were able to really identify not only the gaps in that system, but how we might be able to kind of make improvements for that type of call, but maybe future ones. So I would say that level of relationship building and access did take some time, but now we're in a place in which council or the mayor can come to our team and say, hey, you know what you did for the mental health crises? Can we do that now for our homeless response? Can we do that now for other forms of 911 or 311 calls that are coming in? And we can say, yes, we have a blueprint, we have the relationships, let's do it again.
Yeah, I'll just add from Charlotte, when we were working with the RAND Corporation, we really had the mandate from council in terms of recommendation 3 to work with an external partner. And so it was about building trust with the police, as Taylor said, because while we have a mandate from council, CMPD is also, are still our colleagues with the city, and are really important to continue to have good working relationships with them. And so that was part of the 12 million pieces of data that they gave over to the RAND Corporation to analyze. And one of the things that we found through that work over, I think, a 5-year period, they found about 250 instances of force. And so CMPD, before we went public with that, went back and actually reviewed each 250 of those. And there were about 100 instances of data discrepancy. And so all of the information input from officers is just an officer on a scene inputting something. So it is all, the best we can do is what people are inputting into the system. And so a use of force automatically requires a corresponding internal affairs investigation, which we couldn't find for a number of those. We reviewed any body worn camera footage and tried to do all of the things to understand what's happening there. And so the end result is CMPD actually made changes to their use of force reporting, where they now include more narrative section where they can describe what's happening preceding and post a use of force. And we put out an annual internal affairs report. And so we're also going to improve the reporting that we do on those uses of force for the public, so people understand what is happening before and after those instances of force.
Yeah, for us in St. Louis, I'm in a different position I think than my other two colleagues, in that I work in the mayor's office in the last 2 administrations, so getting data hasn't been a problem. We have partnered with the Center for Police and Equity, as I mentioned earlier, and we provided them with a lot of data on use of force. So they are doing an analysis of that now. So St. Louis, I can say, since my time here, has been very open to sharing data to outside partners to make sure that we can fashion the appropriate reforms.
Thank you. All of you also touched on bringing the community in, partnering with the police. Charlotte, you talked about that relationship. Taylor, you also talked about the contentiousness because of some of the recent events there. Can you touch briefly, specifically about the barriers and how you overcame them?
I can kick us off here. So Julia referenced the community input group, which was approximately 20 individuals that ran the gamut, from pastors to activists to persons that were directly that were had family that had sadly lost their lives at the hands of police. And this might sound cliche, or it was really building relationship. It was getting people together and having the hard discussion and empowering them enough, or giving them the opportunity enough to impact policy, and the recognition that they couldn't lose that opportunity because of the differences and the divisions that existed amongst themselves. And so it was a lot of work. Trying to corral 20 people is difficult. Trying to do it via Zoom during the COVID era, made it even more challenging, but we created a format where we had experts present first, and then we had breakout sessions where individuals, collectives were able to work together to really provide those recommendations that you see now that have impacted the direction we have taken as a city. So affording our community the opportunity to directly impact policy, doing so in a manner where we're really acknowledging the worth that they bring to the work, and the desire for us to hear their voice and put that as the center of the work that we're doing, proved to be, I believe, really effective.
Really resonate with a lot of what was being shared. And yeah, I would say kind of for City of Minneapolis, when we were doing our design process, there was probably kind of like two key moments in those steps in which we really brought community in. One was during, of course, those surveys where we're engaging community at really kind of a high level. And some of the barriers there was just being sure we were reaching underserved populations there. We recognized that, doing something online isn't the most accessible for a variety of different cultures. It tends to be more of a white audience, more of a female audience, more of a kind of like your 30s and 40s age. And so we were recognizing that when we had this high level of quantitative data, we needed to also then bring people to the literal decision-making table, which was virtual in that time, to really be a part of the design process and maybe even critique what we may have found from some of our other data points. And so one of the ways that we did that in kind of our second, or the second moment for me would be the design workshops, where it was a series of those 4 virtual sessions using Miraboard, which is like a really super fancy whiteboard essentially, and really brought people in that were both practitioners in the mental health space, both the folks who have lived experience. And we had a moment in which our advisory group was half staff, half community members. And we recognized that that actually 50-50 split wasn't therefore equitable for us to actually move forward with designing. And we needed to take some staff off the advisory group. And it was a moment for us to really pivot. And we heard that from the advisory members who were community members saying, I'm a little worried about talking because these people have so much expertise. And so we really needed to have a constant iterative approach to say, okay, let's pivot, let's change this up. We also really made sure to pay folks. We recognize that people who provide their time and service to the city, that's not free, and it shouldn't be just taken for free. And so we made sure to provide stipends for community members who participated, because we felt that their lived experience was valuable to the city's design process. And then finally, we had them participate in the presentations to council. That was a major piece to really have those ideas come directly from community members versus staff. I think really helped to resonate with elected officials in order to adopt those pilots going forward.
I could jump in, Taylor. I'm so glad you said that about valuing lived experience. As someone with lived experience in the criminal justice system, I advocate for exactly what you said. Lived experience is experience, and we provide a viable resource to the cities when they're doing a lot of their policy initiatives. Sorry, was someone about to speak before I just jumped in?
I mean, I'll jump in. I don't want to. I'm going to piggyback on what everyone said, but I'll just add a couple of thoughts. One is, I mean, we're fortunate in St. Louis where we have a lot of outside organizations or organizations willing to come in to work and help affect change. But I will say, I think it starts with defining what we mean by community. I think as Taylor just said, sometimes your community is community organizations, sometimes it's, others. When I think of community, I'm thinking of actually people who live in the community, to your point, people who had lived experiences. And I don't know that anybody would disagree, there's always a challenge, right? So you asked about barriers. There's always a challenge getting to everyone that makes up a quote unquote community. So I think definition is important. I think one of the challenges and barriers here is trusting that because we have so many people coming in wanting to have a part in the work being in St. Louis, people are used to everybody coming in and asking them what they think, but not seeing any action, right? So trust is a problem because it becomes a point where people have to see something happen as a result of the feedback and the input that they're giving you. And so here, that is a barrier that I see. And I think designing the interactions, oftentimes people go into communities and talk to them, and they may bring data, or the language that's used isn't really plain language. It's not something that people understand or can actually even provide feedback with. I think the vehicle with which you do it, often people just use virtual platforms or some town halls, but they're not going into places where people are and people are hardest to reach. And we've done a lot to try and do that. I piggybacked initially on a lot of interactions that would happen with families who were, as Taylor said, compensated for their time. And they were just coming with general conversations and just adding on questions about what I was looking for. So I think we really need to think about that. And I think we got to remember, I mean, we talk a lot about, rightfully so, thinking about people who are distrustful of the police and non-law enforcement responses. But in many communities, you have multiple opinions on that. And I mean, I know here we have a lot of violence in communities. People in the same community who look the same have different opinions about that. I mean, nobody wants abusive police. Nobody wants police to necessarily stop them and all that. But there are many people who do want some of the different responses, and making sure you have conversations with everyone to make sure you're addressing all of the needs and what people want in communities, and you're contracting with community organizations that can provide for all of those range of needs is important.
Thank you again. And you all have touched on earlier about data. And so a question came in, question about how you're using or what tools you're using to collect and share racial equity data. And this wasn't specific for any person, so whoever wants to chime in can.
I mean, I'll start by saying we're trying to get better. So you know, it's just, you know, it's amazing. You get caught up in the work. I don't know about my colleagues, but you get caught up in doing all the things you're doing and driving hard to get things implemented. And then for myself, you take a step and go, wow, we're not really communicating to people in the way we should or at all. I recently brought together a group of community partners to start talking about that, right? And across sector community partners, what makes sense to share? I mean, we definitely need to share. So, but it is still what makes sense to share, and how do we do that in a way that's going to be impactful for the community? So I'll start by saying we definitely need to get better at that.
Yeah, I could jump in here in relation to the equity work that's occurring here in Charlotte-Mecklenburg. We're really at our beginning stages. As I shared, our office started in 2019, and then a global pandemic hit, right? And so from there, we've now established a framework for equity and governance with our council members. Our next step is really to figure out how to structure equitable measurements and really reviewing what the appropriate data sets. Luckily, we have a quality of life indicator database where we have a lot of the information already collected. It's how you turn that information into the most appropriate measurement that'll help determine policy decisions that council would make, and that our staff, as they determine their strategic plans, would also look to incorporate. So we're at the beginning of this journey too, Will. I hope you don't feel bad. You're not alone. And you're reminded regularly that if you don't stop and take the time to really learn what it is you should measure, you're going to keep going around in circles.
I would just add from the city of Charlotte, we have an incredible amount of information available to us, especially around policing and demographics. I think it is connecting that together when we think about some of our corridors work. Yes, we're doing work in historically disadvantaged communities, but what's happening to the individual people within those communities, we just can't say because we're making major investments that we automatically helped a lot of people. And so, our council especially always talks about housing units, but I think the conversation needs to go to, what people are we putting in those houses and what happens to those people. And so I think it's, starting to shift a conversation from the things we are doing and building to the people that we are impacting, and, tying those together across a number of different disciplines, because, equity is in everything we do.
I'll probably be echoing what a lot of folks are saying, that it feels new. It feels sometimes not even really tangible. A couple contextual pieces I'll share from a Minneapolis side. We have an office of race and equity, which is now being transformed into the Department of Racial Equity, Inclusion, and Belonging. As of 2023, our city is going through a major restructure of our governance system following last year's election. And so with it, there's a lot of just kind of structural changes. And one of the pieces would be we have had this strategic racial equity analysis, which is a part of the city's budgetary decision-making. And while there is a lot of talk of racial equity, it can be hard to measure on an ongoing basis. So maybe it's there at the on-site or thinking about it from a design side, but then later on we say, hey, did you have the intended consequence that you wanted? We're not really sure. And so one of the things that our office is doing as part of our performance management system, which is kind of those key performance indicators for those core services, is to link those individual metrics to the city's strategic racial equity policy goals. And that is a major shift in not only the way that perhaps department leadership will be thinking about their work, but we hope it will also translate into how the council, as a legislative and budget decision makers, will be able to allocate funds for programs that are addressing disparities or inequities within the city. We are definitely a few years out from being able to see like exact reports or charts, but it's a part of the planning process. And so I just echo everyone to say that it's long, it is tedious, it can feel really challenging, but I think that we have a lot of partners in the city who are really dedicated to ensuring that that is at the forefront of the conversations, because we all have a part to play in addressing inequities and disparities within our city.
Thank you, Taylor. And that's a perfect segue. I'm going to kind of combine a question from the audience along with acknowledging what you said about the importance of having the metrics so that you can go to the council and say, hey, this is working, give us some more money to continue to do this, right? You know, that's one of the best things you can advocate for continuing a program or a policy or an initiative. And so Adam from the audience asked, was it easier to secure follow-up funding if you had actionable metrics to show overall cost savings, or do you think relationships were more important? Taylor, go ahead.
Okay. I would say that for us, both, unfortunately. So relationships were 100% necessary. Our city operates currently in a kind of a, well, now a strong mayor system, but at the time it was a split between council and mayor. And so really we were looking at strategically, how many council members can we get a majority in order to push certain things forward? And so yes, relationships were 100% necessary, because we were able to tie, hey, your constituents in your ward want this to happen, and we can back it up then, part two, with data, because we can say, hey, here's where these services are going. This is the type of service change that we're proposing, and this is what people want, and we're doing it. Do you want to meet the need? And we know that that is the language that is spoken up from a political side. From a leadership side, it was honestly about both relationships in the sense of, do we have the allies in the room to get us, you know, get our foot in the door, get access to data. But when it comes to ongoing funding, this kind of follow-up, now that we're kind of post-launch and wanting to grow into 2023, it actually is more so about data than relationships. It's about being able to prove it out and be able to back up our request with some hardcore metrics. And in our recent presentation we gave last week, we have those listed out. I'd be happy to share that with folks around number of responses, where we're going, how quickly are we, how are those calls being resolved, what percentage of overall calls are being taken. Like, these are some key, some basic metrics that we can then build upon going forward for more funding.
From, oh, you go, Will.
No, go ahead.
Okay. From the city of Charlotte, I think it's much more relationships. When we got the $1 million for our Cure Violence program from Wells Fargo, someone randomly called me on my cell phone from Wells Fargo and said, we would like to give you $1 million for this program. And I said, how do you know who I am? And it happened to be, he was in a meeting with someone from the United Way, who we worked with on another one of our Safe Charlotte recommendations. And she recommended me as the person, and then, you know, connected with Federico, and we got the $1 million. And so through all of this work, all of our violence work and our reimagining policing work, we didn't do anything by ourselves. And I think that's really important in terms of making sure that your message and what you're trying to do as a city can get out in the community, and people can start to remember that and latch on to that. And so, you know, we just received another $1 million from Alma Adams' office to expand our alternatives to violence program. And we have 6 months of data on the existing program, not much to show for success or not yet. And so it really is about partners and making sure that your messaging, I think, is consistent with your partners, so then they can, you know, be your advocates and messengers in the community.
Yeah, if I can add to that, Will, before you jump in, I just wanted to, so we took that money from Wells Fargo, and we were actually able to leverage it through a relationship with the Greenlight Fund, a major funder, who then tacked on an additional $200,000 and provided technical support for the organization Youth Advocate Programs that is hosting the Cure Violence work here locally. So I think I'm echoing what Taylor said in reference to, at the beginning, relationships are highly important to get something launched, but after the launch, they want data to prove it. And if you don't have that data, then those relationships become more challenging, right? Because they want to see that what has been invested in is showing fruit.
Yeah, I mean, I'll agree with everything you said. Just what came to mind to me is something that I don't think any of my colleagues said, but I'm sure applies to all of them, is the legitimacy. You can provide data all you want, but if people don't believe in you, they don't have faith in you, they're not going to believe it, right? Because data is often just numbers, right? The other thing I'd say is, and we didn't explicitly call it out, but qualitative data is important in all of this work. We can't get caught up in numbers. I believe it was Julia that said something about people. You have to make sure you're providing data, but you have to focus on people. You have to focus on the outcomes. You have to focus on the impact on people, because it's easy to poke holes in just general numbers, up, down, whatever. What does that mean, right? I do think it's important to provide data. I think Julia just said this too, or maybe it was Federico. Provide data along the way when you get these things started. My office just started recently. I just started this work in 2018. We just started a lot of our call diversion work in February last year, but we provided data as we went along. It wasn't perfect. It wasn't always the same. It wasn't meant to show that it was working or not, but we were providing people with information. So don't let the perfect be the enemy of the good when you start to think about data, and get outside partners. And when you can, to do some type of analysis. We had MasterCard come in and do a scan and collect data, and use some software that they had to provide an initial look at what was the impact of the work that we were doing. So I think all of those things are important, and I think they all go back to, I'll go back to where I started, legitimacy, which everybody, all my colleagues on this call, I'm sure, have in their communities.
Thank you. Just want to give a heads up. We have about 7 minutes left in the overall Q&A. I kind of stepped on Kirby's toes and went to the audience Q&A and just kind of combined our two types of questions. So the next one is for whoever wants to answer. How do you address racial equity as it relates to ensuring leadership and your frontline staff reflects an equity lens?
So from the leadership perspective, I think I referenced earlier our equity and governance framework. That framework has a racial equity tool built into it, where all policy decisions would apply that racial equity tool. But it's at the purview of council to do so. On the other end of the spectrum, our work within staff and departments, we have an equity and budgeting tool that's being implemented to address the needs of our specific community. And so Again, how are we prioritizing individuals that are least likely to have their needs met or have historically been disenfranchised through our processes?
Yeah, I think you got to consistently be looking at your data to see who you haven't served. If you really want to think about equity, because I mean, we're talking about racial equity, but there's a lot of equity that goes along with that. That's important because you don't want to leave anybody out, especially in your most marginalized communities. So I think it's also being bold enough, strong enough when you engage with organizations, when you're providing funding for organizations, to call that out. We're fortunate here in the city of St. Louis, we have a Black female mayor, the first one ever, you know, and a lot of our leaders and departments are, but when we get on calls with organizations, oftentimes they don't represent the communities they're serving. So you have to call that out and make sure that it's clear that that's important to you, not just at the higher levels, but also at the service delivery level. So it's not just about data on the city side, it's also about those organizations.
Yeah, thanks for the question. And for the city of Minneapolis, I was already kind of sharing a couple tools that are used by our colleagues in the Department of Race and Equity, the Strategic Racial Equity Action Plan, which is very specific, similar to kind of Federico when it comes to program allocation, that it needs to be measured using racial equity lens, both from development and any type of like budget change items. So when things are going to be increasing in funds, we need to back it up with what the impact may be. But there is definitely more room for improvement to be able to measure that on an ongoing basis instead of a one-time. So that's definitely from like a policy and city leadership side. From a day-to-day, I would say that the city, one piece that I'm particularly proud of is our partnership with the Government Alliance for Racial Equity and some of the embodied anti-racism practice and community practice work that happens at the city. So staff are able to join facilitated sessions, brave space or safe space sessions in which we can not only be able to do the work individually, because if we can show up and recognize our own biases in the work that we do, that can then translate into how we interpret policies, interpret our work, and deliver services. And so it's a bit of kind of an individual employee retention process and program that the city is investing in order to really dig deep into what we mean by being an anti-racist city. And then in addition, really being critical of our own policies and practices, because we know they're really entrenched in just white supremacy as most governments in the US are. And so how do we disentangle those two? That's kind of like perhaps a lifelong goal for any kind of major city. But right now, there are some of those two key pieces around embodied community of practice, as well as some intentional work at the leadership side. Both are programs that I'm a big advocate for that other teams within the city are working on, but of course they tie into how then we show up as consultants or performance managers with departments.
Thank you all. I'm gonna end with this last question. I'll go, Taylor, since you're the last one to talk, I'll start with you, Will, and then Charlotte, if that's okay. And so you've all talked about what the issues are, and you've talked about the zip code, where disparities lie. Sometimes the zip code. Will, you mentioned a street where you can just separate the city. So how do you, this work that you're doing, what do you envision and how do you see this work lessening disparities and leading to more equitable outcomes? I know that's what this whole conversation has been about, but can you give us like as my director says, a Polaris, a North Star of what this work will look like? Since you've all mentioned this is the beginning, what will this look like in a few years?
I'll keep it simple and say that we need to rebuild trust within our community. We recognize that trust has been broken, people have been harmed, so people need to heal, but they also need to be able to see in action and practice what we mean by reimagining, by really not only investing, but going out into community and rebuilding those relationships so that we can move what I would hope is a reimagined public safety approach, is one where anyone feels like they can trust and rely on their city government to handle issues that they have, whether it's emergent or not.
Yeah, I mean, this is a great conversation because everyone's saying all the things we will all say. I guess I'll add to it and I'll frame it in this way. In the short term, it's about meeting people's basic needs in real time, better connecting them to community health and organizations and community organizations so that they know where to go when they need help. In the midterm, I think is building structures of data collection and integration where you have the centers and the spaces where people can go that are outside of what are considered now the institutional norms at our hospitals and jails, and you have other places. And I think in the long term, you have improved third grade reading rates, you have improved graduations, you have higher employment rates and within these communities that we look at now as marginalized communities. You have people with more health insurance and more better health outcomes. You have longer lower mortality rates for infants and older adults. And so I think it's really just changing these specific communities, but I think we also have to keep the focus on the communities that are most marginalized because, and I'm an old man, so I grew up in New York City, the neighborhoods that were at the top of crime and all the other indicators when I was young are still at the top, even though those indicators may be lower. And unless we have a sustained approach and investment in those communities, we're not going to see that change. So it's making sure we keep the eye on the prize and really transform those communities.
I'll go first and then let Fed close it out since he is our Office of Equity manager. I think for me, it is continuing to reiterate the message around providing the right response for what our residents need and recognizing that that does mean 6 areas in our city are going to get significant investment and significant attention because they haven't over the last 50 years. And just being really firm and strong on that, not in a way that makes other areas feel like they're getting less than, but in a way that helps them recognize this is why we need to do this, because for, the half of the century, we didn't support these communities at all. And so I think, for me, it is just sticking firm with that, making that our city messaging, getting the business community to buy onto that and see themselves as being active participants in helping to rectify and mediate some of those things that they might have been played a part in as well. Charlotte is a big banking city. Banks did a lot of damage, but I would say they are some of our biggest donators in terms of funds to help address some of those inequities that they help perpetrate. So that's mine. Fed?
Yeah, it's cliched to say I want a community that's actually hopeful, right? But that's what I think we all desire. Sadly, the realities have been that hope has been lost because the trust is not there, to Taylor's point from earlier. So regaining that trust, applying really innovative solutions that are community-centered, and really ensuring that people's voice are heard, that we create the mechanism by which everyone's voice is heard, and that we disrupt systems. All of these systems are working exactly as they've been designed to work. So the more that we can change the system to better reflect the needs of our community, the better off we will be.
Well, thank you all. Fed and Julia from Charlotte, Will from St. Louis, Taylor, Minneapolis. There's questions we didn't get to in the Q&A. It's been definitely an engaging conversation, a lot of interest from the audience on getting more information and hearing this webinar, which will be sent out in a week or so. I'll turn it over to Kirby for the closing and wrap up.
Yeah, sure. I think we're just going to close out with some resources. Can we go to the next slide? I think we have to skip 2, actually. One more. Yeah. So we have some resources here that I think we're also going to put in the chat of some of the work that Minneapolis, Charlotte, and St. Louis are doing, and then also some other broader resources. Next slide. Yeah, some of the information that we shared early on comes from some of these reports as well. So we'll make sure that these are accessible. Next slide. One more slide of resources. So we have lots of good information to share. Next slide. And then I think I'll hand it over to Jasmine to close us out.
Thank you so much. I really just appreciate the robust conversation that we've had today. As I just recently chatted out, we're going to have office hours that will be facilitated by NLC, city leaders, advocates with lived experience, but also resource experts. We hope that you will join us. In the chat, you will see the registration links for both, and we'll also send those out via email. The first one will occur September 26th, and there we will include topics about community engagement, credible messengers, hiring practices, and professional development, and also so much more. So we hope you will join us. On September 27th, we will be covering exploring alternative response equitably, and we will be covering topics such as building infrastructure, staff training, community engagement, capacity building, alternative responses that promote equity, as well as so much more. If you have any questions about that, please feel free to either email Felicia at fwright@csg.org, or you can also email me. My information will be on the next slide. Next slide, please. My information is below at jwilkerson@csg.org. On behalf of CSG, I want to just thank everyone for their participation in today's webinar. We've certainly learned a lot from NLC, Charlotte, St. Louis, and Minneapolis on how they've implemented racial equity into their jurisdictions. As you know, there is no one roadmap on how to make this work for your particular jurisdiction, but we do hope that we've sparked some new and innovative ideas. We hope that you will join us at the Racial Equity Office Hours for further discussion. As previously mentioned, this recording will be available within a week or two of today's presentation. If you have any questions, please feel free to email me. Thank you, and again, take care.